I was an athletic trainer. I worked with Division I college athletes. I worked with sports injuries, and I always thought I could do a little bit more. So that's what got me to PA school. Then I actually had a rotation in PA school with plastic surgery, and we worked with a lot of breast cancer patients, and it was a really cool population to work with. It's a tough patient population because it's a tough diagnosis, and you know, there's ups and downs, and there's these patients truly look to you as for guidance. It's a journey, and I'm with them at the time of diagnosis, during surgery. I scrub into surgery. I'm there with them afterwards. I see them kind of at their lowest, and then most often, because breast cancer is, for the most part, a good prognosis, for the most part, I could see them at the end of that journey as well. So it's, I kind of like seeing it all the way through. Most often the patients know their diagnosis when they come and see us for the first time. And then usually we spend probably at minimum an hour with the patients. The surgeon I work with, we kind of have a system where she goes in, she kind of does her thing. She goes over the diagnosis, the treatment options, the surgical options. And I usually kind of come in towards the middle or end. I'll be the one getting you set up for surgery. You'll see me again. So usually I clear patients for history and physical. And then, anything else they may need. I've had a lot of patients that come in and say, oh, this is probably dumb why I'm here. And they downplay why they're there. And it's like, well, no, you're concerned enough to call and make the appointment. And so I'm happy to see you. And I try to make that very obvious right away. Patience and their gratitude is what's definitely the most rewarding. They ask me, are you going to be in the operating room with me? And when I say yes, I'm the first assistant, I'll be helping the doctor, and they always are like, good, oh, I'm so glad. And it's really, that's nothing I never get sick of hearing that.